And invoking Richard Florida's creative class, he spoke that college graduates are very mobile. That being said, do you think the argument for state funding is undermined by the large number of college graduates that are leaving the state after graduation? And do you see any ways in which state leaders and University of Michigan or Michigan State University can work together to reverse the trend of the intellectual exodus?
Those are great questions. I did say that human capital is very mobile, and that is true. But it goes both ways. A community like Ann Arbor is also attracting people to it who come from out of state and who become Michigan citizens. So, there is some trading back and forth. Larry Page, the founder of Google, is a great example of this. He's come back to Ann Arbor after starting his very successful business. So I do think that you don't know what will happen down the road, that people may leave the state for a few years, they may come home. And we certainly hope that will happen. I also think that viewing the state university as only for the state's taxpayers is short-sighted, not least because of that federal money I mentioned that's being invested through tax credits and other ways. But I do think that it's important for the University of Michigan, MSU, and Wayne State to continue to work together to try and create more of the jobs that college-educated students want to have. I think the University Research Corridor is a great step along that road. We're starting to see now the kinds of collaborative research that I think will eventually lead to longer-term jobs, as well as plenty of short-term jobs for undergraduate and graduate students. And the spin-offs we're beginning to see at U of M, I think do promise that over the long run we may be able to create a pretty good climate for small tech-intensive businesses in the Ann Arbor area. I should also mention our acquisition of the former Pfizer property, which is adjacent to the North Campus, offers a terrific opportunity to us for public and private partnerships, for new kinds of research, and ultimately for job creation opportunities for lots of people from different fields. And it may take a few years for us to get up there, but our early projections show that we might be able to create as many as 4,000 jobs through reactivating what we call now the North Campus Research Complex. So we're very conscious of this. I would say that there's been a sharp focus on economic development in recent years, and you're seeing it in lots of ways at U of M. The increase in our contracts with industry is quite remarkable. The increase in the number of patents we're filing. Obviously, I mentioned the increase in the research dollars and the increase in the number of spin-offs. We have a very active tech transfer group, which is making it easy for faculty members to think about how they could license an invention. When the H1N1 flu was rampant last year, many of you may have children who got the vaccine through that little mist in their nose. That mist was invented at the University of Michigan in the School of Public Health and was licensed. And so that's an example of a way in which our inventors not only help society, but also help us economically. Yes, sir?
Yes, I have another question on the budget. You know the old adage, if you think education is expensive, just try ignorance. I've read in today's newspaper that Michigan, the University of Michigan, and especially Michigan State, they're cutting their budget through health care. That one of the most expensive items for the university is the health care costs, faculty, staff, et cetera. Do you see that as a way to try to trim the budget at the University of Michigan by cutting down on the health care costs?
I think that the announcement for MSU today was they're going to stop funding retirement health benefits for new hires. At U of M, we had a lengthy study in which we benchmarked ourselves against other major employers in terms of our health care benefits for our faculty and staff. And the employer share of our health care benefits was 85% and the employee share was 15%. We are moving over a period of 2 years to a 70-30, which is what we found was more typical in the national marketplace. So we're not cutting back the health coverage, but we are asking the employee to pay more of it. And we have tiered this in such a way that the lower paid employees pay less of an increase and the higher paid employees pay more of an increase. But that was an adjustment we needed to make for exactly the reason you mentioned. Healthcare is a big part of our employee dollar. We do pay a lot for it. And the other thing I would say is that our healthcare program is advised by our own faculty members. And our rate of increase in healthcare is well below the national average. And one of the reasons is we have our own doctors and pharmacists engaged heavily in this. Particularly in terms of our pharmacy benefit, we've been able to cut the cost dramatically. We haven't cut the quality, but what we've done is we've cut what we've spent for it. And we've become a model for many others. Blue Cross Blue Shield is studying, for example, what we've done. So partly because we can provide our own health benefits, we can also use our own physicians to help us design new programs of treatment and contain the costs. I'll give you just one more example of that. If you are diabetic and you're an employee of the university, there is no copay for your diabetic supplies or your medication. The reason for this is that we know over the long run the cost of health care for a diabetic is much lower if the diabetic is taking their medicine. So we believe in the long run we will contain costs by eliminating this copay because we don't want any barriers for somebody who's diabetic from keeping up with their medication regime. Well, that's something we probably couldn't have done if we were part of some big old health plan, but we were able to do it for our own employees, and our early evaluation has shown that it is saving money. Yes, sir.
I think there's a lot of confusion with state policymakers about the real role and benefit of universities, as you talked about. When you talk about undergraduate students, talk about graduate, professional, and research. When legislators look at funding universities, they look at undergraduate enrollments. Right. But they really don't understand the impact. How can we better communicate the impact of really those four major missions that a university portrays, right, and help them have more ownership of each of the four major missions?
You know, it's a real issue, and it's not just at the state, it's also at the federal level we have this problem. So Senator Grassley, you know, is complaining about not enough of our endowment money goes to undergraduates. Well, half of the Michigan endowment is for the hospital. I can't legally spend it for the undergraduates. But Senator Grassley forgets that we have a hospital when he makes claims like this. And I think it's also true of a lot of legislators that they don't see the full mission of the university. We're a major healthcare provider as well as being a major educator of undergraduates. And we do major research, and for that research we need to have a cadre of highly skilled graduate students. And by the way, those graduate students aren't just the faculty of tomorrow, they're also the researchers of tomorrow, because they're the ones who've learned how to do these highly technical operations that are needed by biotech, for example. So you cannot undercut your graduate program. If you do, you run the risk of becoming, well, maybe a really good undergraduate school, but not a research university. There is a value to the research universities that goes way beyond just educating the undergraduates, as important as I think that mission is. And I'm not sure how we get that across. It does mean reminding legislators continuously that not all schools have the same mission. And that doesn't mean that one school is lesser than another. It means their mission is different. The mission of the University of Michigan is a very big, very demanding mission, and we try to meet all parts of it equally well. But it's much more than educating the undergraduates, important as I say as that is. Yes, sir.
Just from a statewide perspective, does it make sense to have the same model we've had for so long of having 15 public universities that all get state funding and are all autonomous boards? I mean, shouldn't we maybe be looking at a systemic change, maybe shrinking the number of public universities, or somewhere around? I think oftentimes we have like a state resource. In other words, there are several medical schools in the state. Now we want to add a couple other medical schools. Do we need those many? Wouldn't it be better to have more of a top-down approach to try to direct what limited resources we have into the priority programs?
Well, you raised some really good questions, and I think those pose some very tough priorities for legislators. It's very hard for a legislator to vote to close something in their own district, for example. But let me talk about the medical school issue for a minute, and I want to draw on my experience in Texas and contrast it with California. So in Texas, the legislators are really concerned that there weren't enough medical schools because they wanted to get more doctors in the state. And so they began thinking about building more medical schools. Meanwhile, the state of California has relatively few medical schools, but they have a whole lot of doctors. Why is that? Because California has lots of residencies. So what happens is that California is a net importer of MDs because they come for the residencies, and Texas is a net exporter Because when they finish medical school with their MD,